A private jet left Victoria for California this afternoon. Inside, a 24-year-old Duncan woman and 2 other sick BC residents. They say they have Lyme disease, but most doctors here say maybe or maybe not. But one concerned father says he's not going to wait for his daughter to die. He's hired a private jet and to take her and the others to a California specialist. Philip Campbell has the story.
Jay McQuhae is trying to save his daughter's life. He's spending $14,000 of his own cash to get her the medical help she so desperately needs. He shot this video as she was being released from the Duncan Hospital last month. Doctors said she was well enough to go home, but she can't walk without pain. This is Marie a few years ago. She was a vibrant, fun-loving outdoors person. While on a trek on the West Coast Trail, she was bitten by an insect, and that was the beginning of her health problems. Jay says she contracted Lyme disease, but most BC doctors, he says, don't know how to deal with it or even how to come up with a diagnosis.
College and the CDC, they violently reinforce their flawed medical guidelines. Since they pulled Ernie Marikami's license, we don't have any Lyme literate doctors that are willing to treat patients in our healthcare system that I'm aware of.
Marie, how are you today?
Marie is preparing to fly to visit a doctor in Redwood City, California, who specializes in Lyme disease. At the airport, a number of supporters.
So all the specialists have to be taught about Lyme disease because it is the most infectious disease in the world right now.
Dr. Ernie Murakami retired from medicine earlier this year. He's volunteering to go on the flight.
And often people are told you have depression because all the tests are negative. And the test that we do in Canada called the ELISA only picks up 2 to 6 per province per year, and yet across the border they're picking up thousands.
Look at you. Look like you do this every day.
Jay says animals have a better chance of getting treatment in BC than humans. Veterinarians are willing to treat dogs, cats, and horses using antibiotics even before they know for sure the patient has Lyme.
As a consequence of those kind of low threshold testing protocols that they have in some of these private facilities in the United States, that there are way more false positives produced in their testing program than is the case in British Columbia.
2 other BC residents who say they're positive they have Lyme disease are on the flight as well. They're all hoping they can finally get relief from their pain.